million member partnership of unions, and our affiliate unions, including SEIU, UFCW, Teamsters, and many more, represent over 100,000 workers in Massachusetts. We strongly support the passage of legislation that protects privacy and our healthcare system by banning pharmacies and pharmacy benefit managers from selling, sharing, or using prescription data for marketing purposes. House Bills 109, 110, and Senate Bills 17 and 19 take important steps in this regard. A perfect example of the need for these bills is the way CVS Caremark, the country's largest chain of retail pharmacies and second largest pharmacy benefits manager, uses patient and physician data to promote drugs on behalf of pharmaceutical companies. CVS Caremark sends letters to doctors promoting particular drugs as a part of its RX review program. These letters are paid for by drug makers and are not necessarily geared to saving money for health plans or consumers. For example, CVS Caremark has sent letters to physicians recommending the diabetes drug Januvia. Two examples of these letters are actually in my written testimony that I submitted, so you can review those. These letters were accompanied by chart inserts that identified the doctor's patients by name, date of birth, patient identification number, and suggested that these patients may be good candidates for a Januvia prescription. According to some doctors, the letters identified all of their patients who were taking another diabetes drug, regardless of whether those patients had characteristics that made them inappropriate candidates for Januvia. CVS Caremark does not receive the consent of the patients or the doctors to market them in this way. While CVS Caremark claims to save plans money, drug makers such as Merck are paying it to promote expensive drugs like Januvia. Januvia is as much as 8 times more expensive than other diabetes treatments, according to a recent study in the Archives of Internal Medicine. And Consumer Reports recommends other, lower-cost generics over Januvia, and says that Januvia is less effective than other diabetes medications. Nonetheless, CVS Caremark's promotional activity helps Merck maximize its revenue. Recently, Merck announced that Januvia sales jumped 64% to $413 million in the last quarter. Change the Wind believes this legislation is necessary to stop companies like CVS Caremark from using prescription data for marketing purposes, which threatens privacy and our healthcare system. Thank you very much for this opportunity to testify.
Thank you very much. Questions on Senator Candaras?
Yes. How do they not run afoul of HIPAA? Is CVS Caremark not covered by HIPAA?
It's a complicated answer, but because they never give the information over to Merck, but that's the shortest answer is because they don't give the information to Merck, they send the letters themselves. It's not covered under HIPAA.
They send the letters.
So CVS Caremark sends the letters to doctors. You'll see when you get the written testimony, and on the letter it says this letter is funded by Merck. But because they're not handing over the protected information to Merck, it's not covered by HIPAA.
I understand that, but who provided them with? How did they obtain the names and birth dates and specifics regarding the prescriptions for each patient? Who gave them that?
Through the pharmacy and through the pharmacy benefits management.
The pharmacy is not covered by HIPAA?
They can use it in this way because they're not sharing it with outside entities. It never leaves. They're saying Merck or Eli Lilly or whatever company, if you give me X amount of money, we will send letters based on the criteria to market your drugs for you. And I go into a little bit more detail in my written testimony.
But because the doctor already has the information, it's not a disclosure? I thought that every instance where they repeated that information, just simply printed it, was a violation of HIPAA.
I know that there is a carve-out in HIPAA for some of these uses of transfers of data, and so I think that's one of the reasons why HIPAA is not sufficient, and we need a regulation at this level. I think that if the pharmacy, like CVS, where a customer's already filled their prescription, it would be kind of assumed that they know the information from that transaction, so there's really not a disclosure in that way. But I understand your concern about the letter to the doctor. That's I think there's a carve out under HIPAA under this. We can look into that for you.
Is there a carve out for commercial use? All right, obviously, I don't want to belabor. Thank you, Mr.